We are privileged to have Dr. V.K. Paul, Honorable Member Niti Aayog, as our guest of honor for today's function. He is associated with India's health policy as well as child and maternal health programs. He has contributed towards formulating the Poshan Abhiyan and the Ayushman Bharat Yojana. He has also worked as a professor of neonatology at the Department of Pediatrics, AIIMS, New Delhi, from 1985 to 2020.
We request everyone to please take their seats.
I now request Dr. Paul to kindly enlighten the audience with his inspiring words.
Thank you. Thank you. Good afternoon. Namaskar. Respected Professor Mahesh Verma ji, Professor Balram Pani ji, Professor Vinod Kumar ji, and our esteemed Principal Dr. Dheeraj Shah ji, faculty of UCMS, representatives of the Delhi University, students, and above all, the recipients of degrees and prizes today, and even more especially, the parents and families present in this hall. It is my true privilege to be amongst you, to be able to participate, although partly, in this wonderful celebration of excellence, achievement, aspirations, hope, and service. Service in the sphere of healing. I congratulate the recipients of degrees, recipients of awards on this day. So a big hand from my side to all the degree and award recipients. I also wish to congratulate the esteemed parents and the families that are present here, or those who are not present here as well, for the achievements of their daughters and sons. Your sacrifices, your aspirations, your hard work, your sanskaras have all come together today as a very major milestone of your children. Congratulations to you once again. Thank you. और उसी पे मैं एक रिजॉल्व ले लेता हूँ. ये स्टूडेंट्स, डिग्री होल्डर्स जरा अटेंशन देंगे. We are what we are because of our parents and our families. And as I said, in our lives, in your lives, they have made sacrifices. So I have one request to make, that will you promise today on this very auspicious and solemn day that you all will look after your parents when they grow old? जोर से ये काफ़ी नहीं सुन रहा मुझे. Will you promise? Yes, thank you so much. Thank you very much. Thank you. We owe it. Thank you. Respected teachers of UCMS, I salute you for the work that you have put in for the service of our nation, for medical profession, for medical education, and for building a strong health system in your institution. We have seen many milestones in the history of UCMS, and my first recollections are when I came to study my medical education at AIIMS. I learned that a year ago, I came in 72, and I believe you are 71 by birth. A new medical college has come up under Delhi University, and the classes were being held in Safdarjung Hospital. So I've seen the journey of UCMS over a period of time. I feel very proud. I feel very proud to note that you are considered among the very best in the nation. You are consistently within the first 10, and I believe at times you were within first 5 in this great, large nation. I congratulate you. I thank you. I adore you. And on behalf of the entire national fraternity of of co-professionals, and now also in my role as a policy enabler within the government, I congratulate you. So big hand to the journey and achievements of UCMS. Thank you. You reflect excellence, you have practiced excellence, and there are many, many more milestones that we expect from you. On that note, I have a request to make to Professor Balram Pani ji, in the presence of Professor Mahesh Verma ji. So मेरा पहला सुझाव, पहली सबमिशन ये है कि सर 50 साल से ज़्यादा हो गए हमारी इंस्टीट्यूशन को बने हुए. दिल्ली यूनिवर्सिटी इज़ क्राउन में एक जूल है देश के, और हम उसका हिस्सा हैं. दिल्ली यूनिवर्सिटी कंसिस्टेंटली टॉप पे मानी जाती है दुनिया भर में. आप 5 नंबर पे हो लास्ट NRF रैंकिंग में. सर मेरा सुझाव ये होगा, and with support from Dr. Mahesh Verma ji as our mentor, that time has come that we sit down and assess and study and recommend what we can do to take UCMS to the next level, and why. Because Viksit Bharat will need many, many more centers of excellence above where we are. And that applies to all of us. It applies to AIMS Delhi, it applies to Niti Aayog, it applies to your university, sir, Indraprastha. हम सबको ही सोचना चाहिए. You are aware that there is a major effort and initiative within the government of how to look at each sector and position it for Viksit Bharat. हर सेक्टर में बहुत कुछ करना पड़ेगा. तो जब हम उसकी बात करते हैं तो जो उसके घटक हैं उसमें भी बहुत कुछ करना पड़ेगा. So my humble and official public suggestion is that let's all sit down, the university, the government of Delhi and the government of India and other stakeholders, experts, thinkers, faculty, alumni, कि हम जहाँ हैं अब UCMS, तो क्या हमने among the world's best बनाना है क्या? मैं कहूँगा कि उसके लिए चर्चा होनी चाहिए. फॉर्मली करते हैं, देखते हैं कि ये पाथवे क्या है. दिस कुड ऑल्सो बी टेम्पलेट फॉर अदर इंस्टीट्यूशंस, बिकॉज ऑल आर इंस्टीट्यूशन, यूनिवर्सिटीज, हॉस्पिटल, वी हैव टू रीच द नेक्स्ट लेवल. So this kind of a churning will help us devise that path. So I humbly submit that here that the leadership be taken or initiated, the process be initiated and steered by Delhi University, Delhi विश्वविद्यालय. आपके वाइस चांसलर साहब से निवेदन होगा हमारी तरफ से, ये मैसेज करिए सर. एक ग्रुप बनाते हैं, उसके बाद देखते हैं कहाँ तक रिसोर्स आएंगे, फेजिंग क्या होगी. लेकिन जिस इंस्टीट्यूशन ने जो हमारे फर्स्ट 10 में है, हमें क्या कोशिश नहीं करनी है कि वो 2047 तक दुनिया में फर्स्ट 50 में हो कम से कम. दैट्स माय कॉल टू एक्शन सर. महेश वर्मा सर, इसकी करोलरी ये भी है कि आप बाकी आपकी इंस्टीट्यूशन है उनमें भी काम करेंगे. लेकिन आज सर से मैं अनुरोध करूंगा, एंड योर हेल्प विल बी नीडेड, एंड आई विल बी वेरी हैप्पी टू प्ले माय लिटिल रोल in this exercise. So that's my first humble submission. My second suggestion, before I come to dear students, as my final message to you, is that our nation needs family physicians. हमें family physicians की availability, pipeline की चिंता करनी चाहिए. We cannot have a scenario where the whole health system is fragmented by specialities and specialists. This is a serious nature. And what I'm saying is not my personal opinion. It is enshrined in the National Health Policy 2017. It is enshrined in the National Medical Commission NMC Act as a specific clause that we shall promote this. And I tell you, there is a dismal situation with regard to that. Imagine a scenario that we are increasing our postgraduate seats. Well, undergraduate seats have now become 129,000 with a base of 2014 of 51,000. Postgraduate seats have increased from 31,000 to 78,000. होना ही चाहिए. Often for specialist needs, the differential is 4 to 5x shortage. 1/4 है यहाँ 1 होना चाहिए. तो वो तो करना ही है, बिल्कुल करना है. लेकिन human health and illness and care cannot be fragmented. If we continue to do this, we will face a very major problem. Now, you may say that we have MBBS. Of course, we have MBBS. But with increasing time, if we don't create a general practice cadre, and MBBS has limitations, and I'll come to that in a minute, to be able to serve today's fully loaded general practitioner. It has happened. I'll come to that. We would have a scenario that actually we will have fragmented, specialty-based, costly, and duplicated health services. I wish to apply your mind, and 2 universities are represented. Between the 2 of you have, at least 9 medical colleges, if not more, and you have PG institutions. And let's be the model. We are Delhi. We are the capital of India. Let's be the model. So I urge you, both universities today, that you please institute a system of family medicine as a specialty at MD level to be initiated in all your institutions. The total pipeline for family physicians is within the NMC system less than 100. It's probably less than 50. In the DNB system, about 90, 100. Diploma, another 5. It's less than, put it all together, less than 600. How many surgeons we have now, surgery seats? At least 6,000, if not more. So there is an imbalance that our pipeline is not there. And why do we need that? We need it because holistic care, next door doctor, is needed, who can look after a newborn baby and the elderly. In fact, perhaps the best use of the family physicians will be the elderly. And today we have 10% of us, and by 2047, we will be 22%, a 35 crore population. And if you fragment their care into 7 specialties, skin, heart, hypertension, we are in a very serious scenario. Now, today's MBBS, whatever, I am a teacher, lifelong, you are teachers here. We cannot give all the competencies that are required for a competent family physician who is world-class and who can meet our needs. It is not really possible anymore. The one reason for that, and I'm sharing this here with the faculty, is because for the diseases of today and tomorrow, the exposure of our curriculum, no matter how hard we do, cannot be achieved optimally. Let me give an example. If I have to be able to have a MBBS doctor to be able to prescribe first-line therapy for severe mental disorder, schizophrenia, क्या मैं कर सकता हूँ? Confidence है कि मैं दवाई लिखूँ और follow करूँ? Diabetes, कर लेगा शुरू, बाद में क्या करना है? क्योंकि हमारे सिस्टम में क्रॉनिक डिजीज को फॉलो करने के 50 केसेस ऑफ डायबिटीज हम नहीं कर पाते, नो मैटर हाउ हार्ड यू ट्राई within the system, because we have basic sciences, we have other things to do, ethics, and so on. Chronic disease learning, and that's what our challenge is: hypertension, the diabetes, and cancer care, geriatric, multiple problems would need, let's say, for each one of them, 50 cases being followed up over a period of time. When do I go to second-line therapy? I can start first-line hypertension therapy as MBBS. What about second? When do you do that? Third. कहने का मतलब यह है कि वो हम जितना भी कहें उस पीरियड में नहीं है. इसीलिए जब विकसित भारत की बात करते हैं तो विकसित देशों में फुल फ्लेजेड जीपी के कोर्स होता है या फैमिली मेडिसिन होता है. यूरोप में भी होता है, अमेरिका में होता है. यूके में 5.5 years, 6.5 years के बाद में 4 साल, 4.5 साल लगते हैं तो जीपी बनना है. और देशों में भी यही होता है. सो प्लीज कंसिडर दिस. एंड ऑल्सो सेकेंड पॉइंट, इंटरनल मेडिसिन इज नॉट फैमिली मेडिसिन, इट्स अडल्ट मेडिसिन. वो बच्चों को नहीं देखते, किसी बुलावे में नहीं रही है सर, तभी वो इंश्राइंड है एनएमसी एक्ट में. दैट्स द विल ऑफ द पार्लियामेंट एंड वी नीड टू रिस्पॉन्ड टू दैट. कम्युनिटी मेडिसिन ऑल्सो इज नॉट फैमिली मेडिसिन. कम्युनिटी मेडिसिन इज पब्लिक health on scale. We don't train community medicine doctors to treat diabetes over a period of time, or even to treat emergencies. कि आपके स्ट्रोक का पेशेंट आता तो फर्स्ट लाइन आप आईवी क्या दोगे, हम नहीं ट्रेन करते. फैमिली मेडिसिन का मतलब है ट्रीटमेंट, नॉट पब्लिक हेल्थ. इंडिविजुअल ट्रीटमेंट ऑफ कंडीशंस, मेंटल हेल्थ, इन्फेक्शंस, चेस्ट, एवरीथिंग. And internal medicine, I repeat, is not family medicine. बहुत कुछ छूट जाता है. तो मैं ये कहना चाहूँगा, humble submission enshrined in the National Health Policy, will of the Parliament, I request the two universities, can you please start family medicine courses and be the model. WHO recommendation is that 30% doctors should be family medicine. OECD countries which are developed nations, again, exactly 30% उनके जो होते हैं वो general होते हैं और 70 specialties होते हैं. We need the next door doctor. That has gone extinct. We are facing a major crisis. So ये मेरी दूसरी रिक्वेस्ट है. सब लोग बैठे हैं और ये सब यहाँ जो हैं टीचर्स बनेंगे, एकेडमिया में जाएंगे, तो प्लीज़ आगे लेके जाओ. Lastly, to our dear students, firstly, पहली रिक्वेस्ट, you please join academics. सोचना नहीं है ज़्यादा. There are 119 medical colleges. In 2014, there were 387. We need faculty. We need you to establish specialties. We need you to run these great medical colleges, public and private both. More so the public medical colleges. Please follow that path. And I can assure you, there are enough salaries there. But you'll have tremendous satisfaction of building the health system of India. Because from there, centers like yourself, you are a center of excellence. And tomorrow, we will reach another new height in this regard. We have first expectation, and we believe it is your duty to first option to consider, get into academics, medical education, research, innovations, use of AI in health. आप करके दिखाओ. We don't have a perfect system in these medical colleges. Don't have that expectation. You will make it perfect. सब कुछ नहीं है कि मैं perfect हो गया हूँ तो मुझे perfect system चाहिए मैं तब. No. In nation building, perfection is not there. That's why हम nation building का हिस्सा बन रहे हैं. जब बन जाएगा तो उनका attitude होगा वो देखेंगे. Be part of nation building and building of the academia of medical education. So that's my one request to you. Please do consider this. There are huge opportunities. Even within the 22+1 aims, as you are aware, there are 35-40% vacancies, I am told, from the newspaper reports continuously. So please, you have great opportunities there. You can always get into the other side. But please do consider to be part of academia. That's my first request. Second, dear friends, I like you to look at two important issues as I close my remarks late in the day. First, I urge you that as we move from this level of our status, our health system, our medical education, what we need first and foremost is excellence. Excellence. Excellence means अच्छा करना. Excellence means बहुत अच्छा करना. सबसे ज़्यादा अच्छा करना है. इसकी रोज़ सोच होनी चाहिए. And let me elaborate that. Whatever we do, let us do it with best of our zeal and ability. Let us not take shortcuts. Remember a quotation which is attributable to Aristotle, and that's my favorite quotation. I quote, "We are what we do repeatedly. We are what we do repeatedly. Excellence is therefore not an act but a habit," unquote. We are what we do repeatedly. Excellence is not an act but a habit. What does it mean? It means हमें रोज हर पल अच्छा करना है, तब हम अच्छे हैं. 100 मीटर की दौड़ में आपने एक बार ही क्लॉक कर लिया तो वो एबिलिटी है आपकी. क्या रोज करते हो? जब एग्जाम आता है तो सवालों के जवाब अच्छे देते हो. राउंड किसी डॉक्टर शाह का होगा तो केशिर भी अच्छी दिखेगी, शायद काउंसलिंग भी आप अच्छी करोगे. ऐसे देखा सबने, हम सहा भी, शायद करा भी. लेकिन वो आप जो रोज़ कर रहे हो आपका लेवल वो है, उस दिन अच्छा कैसे हो जाता है? आप थीसिस लिखते हो, हर टेबल पे सारा कुछ है क्या, रेफरेंस लिखी हुई है. मैं कुछ एग्जांपल दे रहा हूँ इसीलिए. हर टेबल में जो गुण होने चाहिए वो है. आप जब लिख रहे हो तो रेफरेंस लिखते हो तो प्रॉपर स्टाइल में लिखते हो. रोज़ करोगे तो लगेगा कि आप वो हो. जब दिखाना है कभी कभी दिखाया तो वो तो एक्ट है ना, हैबिट नहीं है. एक्सीलेंस हैज़ टू बी मेड अ हैबिट. Only then will you excel, you will perform better for the society and for the nation, and make excellence a habit, not a hobby, and not a ritual for exams, not a ritual to impress when the time occasionally you think it should be done. No, habit, 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 on a daily basis. Why our prescriptions today are so lousy? Sorry, I'm using a... You do randomly look at the prescriptions that are being written. Even the courts have taken cognizance of this. Pediatrics में तो बताया जाता है कि वजन होना चाहिए लिखा, immunization, development, nutrition, थोड़ी history, थोड़ा examination, differential diagnosis. उसके बाद ये सारा गायब होता जा रहा है. Prescriptions are the my certificate of what I am. वो लिखा है ना, we are what we are, जो repeatedly. तो वो हमारी what is the external face of a doctor? Ultimately, जो आप लिख रहे हो, because we are in the business of problem solving, knowledge, comprehension, application, synthesis, analysis, all this is to take a decision for the patient. And how do you communicate that decision? Partly verbally, which cannot be recorded, and surely in writing, which can always be seen. So you are what you write on a prescription. I urge you that you please make sure that your prescriptions become from good to better to the very best. And I urge the faculty, please conduct prescription audits. अब देखिए कैसे हम लिख रहे हैं, आदतें ठीक करनी चाहिए. कुछ समझ ही नहीं आता, फीवर, पैरासीटामोल, some eligible sign. No. हमने तो शायद ये सोचा था कि 30 के बाद में ब्लड प्रेशर सबका चेक होना चाहिए, तो नेशनल पॉलिसी है. क्यों नहीं करा हमने? जब पेशेंट आया मेरे पास तो फीवर, पैरासीटामोल कर रहा हूँ, शायद देखा होगा थोड़ा बहुत, बीपी क्यों नहीं लिया? 30%, 1 out of 3, and perhaps in Kerala 1 out of 2, Punjab 1 out of 2 have hypertension. You missed it. I think the standards, comprehensiveness of a prescription, that's one example of excellence that I am referring to, but that applies to perhaps many aspects. However, even excellence alone is not enough. I can be very high achiever, excellence, I do good things, but I am not a good person. I don't value the sanskaras that I got from my family, to be polite, to be humble, to be respectful, to have integrity, that I don't fudge data. My thesis is truth and nothing but truth. I don't tell lies. I follow the ethics. We have special part of our value system. एक तो general है, integrity, humility, संस्कार, जो भी बात हो गई, वो तो सबके लिए अप्लाई होता है. और कमरे इस बाहर जो है उन सबके लिए अप्लाई होता है. लेकिन हमारे पास तो एथिक्स भी अप्लाई होता है. वो सेकंड लेयर है, शायद इससे भी वो ऊंची है, क्योंकि हमारे ऊपर अप्लाई होती है. उसके लिए भी हमारी जिम्मेवारी है, उसके लिए भी हम फॉल्टर कर रहे हैं. तो वैल्यूज भी, बिना वैल्यूज के एक्सीलेंस alone is not sufficient, and therefore for all of us in our profession, at least, I don't know about other professions, both pillars are important, equally important, excellence and values. और एजुकेशन में कहीं भी आप जाइए, पंडित मदन मोहन वालिया को देखिए, लिखा हुआ है नॉलेज एंड कैरेक्टर. मैं उसको पैराफ्रेज करके कह रहा हूँ, excellence and values. So both faculty, our job is to give both excellence and values. And for values, the responsibility of teachers is to be role models, because students do what we do, not what we say, in terms of the value system, in terms of commitment. Do we turn up in the middle of the night to operate a patient who has no सिफारिश? अगर हम करके दिखाएंगे 3:15 बजे आके, तो ये भी लेके जाएंगे और ज़िंदगी में करेंगे जहाँ भी जाएंगे. Excellence and values must go hand in hand. Professionalism is incomplete without humanism. Excellence without values or vice versa is not good enough for the society and the country and for Viksit Bharat. Excellence and values together make a professional, particularly a doctor, a responsible citizen. And we have the responsibility to inculcate this. With these words, I thank you for the opportunity, Dr. Our Principal Sahab, our faculty, आपने मुझे invite किया. I'm so honored to be here. And once again, congratulations to our dear students. Thank you very much. Jai Hind.
Thank you, sir. I now request Dr. Mahesh Verma, sir, Chairman, Governing Body, UCMS, to kindly felicitate, sir. Sir, your wise words that excellence is not an act but an habit is a mantra all of us should strive for.
Thank you, sir.